Okay, so today we are talking about death with dignity in America. Legal considerations of this policy. So, death with dignity is essentially the name of the policy for the law that allows for physician assisted suicide. Physician assisted suicide is currently legal in 5 U.S. states. Um, and physician assisted suicide is different from both active and passive euthanasia. So, this law would allow physicians to prescribe lethal doses of medication, but it actually doesn't allow them to administer it. That would be active euthanasia, which is a deliberate act by a healthcare provider or another individual that causes a patient to die um, intentionally. And passive euthanasia, which is the intentional omission of action that results in a patient's death. That would be something like taking somebody off a ventilator, taking out their feeding tube, something like that. There is a precedence for passive euthanasia. So, in states where physician assisted suicide is legal, eligible patients can request a lethal dose of medication from a consenting physician. Consenting is really important there because even in states where this is currently legal, neither the patient nor any physician is legally required to participate. So each of the 5 states that have adopted death with dignity laws have the same criteria for eligibility for patients seeking a physician-assisted suicide in hastening their death. And those criteria are basically the patient must be terminally ill with no more than 6 months to live. That needs to be confirmed by multiple doctors. So you can't just go to one doctor who says, "Oh, yep, you're dying," and then you get to have the medicine. The individual requesting must also be competent in understanding and communicating preferences related to their health and their health care. There's actually no metric for measuring this, so mental or emotional competency is sort of just the subjective measure. And that's how it currently is in the 5 states that have this legal. So the prevalence and precedence of this, recent polls suggest that Americans are actually in favor of expediting the death of consenting terminally ill patients. Polls show that around 20% of Europeans on life support will have their deaths therapeutically expedited. So this is popular. This has gone into effect in other countries, primarily in Europe. It's not illegal to commit suicide currently in the United States in any state or jurisdiction. However, those who aid others in committing suicide can and often are charged with murder. The famous case for this would be Dr. Jack Kevorkian, who sort of spearheaded this right to die movement. He was charged with second-degree murder after assisting an individual end their life. He was sentenced to 10 to 25 years in prison. Just as a brief caveat, he actually was taking part in active euthanasia, but he supported this idea of a right to die, which is what the Death with Dignity Act is essentially based on. So there is sort of a history. So the Supreme Court has not ruled that Americans have a right to die. So there's no defined right to die for Americans. However, Americans do have the right to refuse life-saving treatment. This was decided on by the Supreme Court via Cruzen versus director of the Missouri Department of Health in June of 1990. Basically, that court case upheld the argument that you do not have to accept life-saving treatment if you know that you will die without it. So that is an American right. Additionally, when you think about something like palliative care is designed to reduce suffering, but it also often, and in most cases, expedites the death of the patient receiving the care. That's just how it goes. So these things are more closely related than I think people often realize. And the fact that some Americans have the right to expedite their death and others is a potential breach of the 14th Amendment, which essentially says, and I'll just boil it down here, no state shall make or enforce any law which shall abridge the privileges or immunities of citizens of the United States, Nor shall any state deprive a person of liberty or property, life, without due process of law, nor deny any persons within its jurisdiction the equal protection of the laws. It's not cut and dry, but it does raise the question of differential treatment among Americans depending on how many or what state they live in, which is troubling to say the least. Let's move this over here. Okay. So a little bit of history and then the stakeholders. The first death with dignity law was enacted in Oregon in 1994. The law has remained largely unchanged since its inception, and that law has sort of served as the basis or the model for the 4 other states that have adopted these laws. I should mention that there are other states that have tried to enact these laws that have not been passed, but all of them have used either an identical model or something that is nearly identical to the original law that was enacted in Oregon. Stakeholders that are in favor of the death with dignity law and potentially in favor of a federal death with dignity law include physicians practicing in states that do not permit assisted suicide, as well as terminally ill patients in non-permitting states, and those who believe that having a choice in the circumstances of one's own death is a human right. It is important to keep in mind that this law is as much about protecting physicians as it is about granting a right to a terminally ill patient. Stakeholders opposed to this law include those who are morally or for religious reasons opposed to suicide, as well as the American College of Physicians and American Medical Association, both of which disapprove of physician-assisted suicide. The basis for their disagreement is that palliative care is sufficient in reducing or allaying end-of-life suffering. Interestingly, the American Academy of Hospice and Palliative Care officially recognizes physician-assisted suicide as a viable option in the rare cases that palliative care is insufficient to reduce or assuage end-of-life pain. So since the act was passed in 1998, a total of 1,127 individuals have died after ingesting a lethal dose of medication prescribed to them under the Death with Dignity Act. The average age of the patients who have utilized the Oregon law is 71 years old. The youngest individual was 25. The oldest was 102. Both supporters and detractors of the policy are looking at the exact same data, and they're drawing 2 totally different conclusions about whether this is a good thing or a bad thing. And it really comes down to your opinion on the role of a physician and whether or not you support the idea of suicide as a viable option. You can boil it down to that. Little time check here. All right. Enacting a federal death with dignity law would ensure all Americans have the right to exert some level of control over the circumstances of their death. There's already a legal precedent for death with dignity, as it's been successfully implemented at the state level for over 2 decades. The policy, again, would protect physicians who want to accommodate their dying patients' requests, regardless of the laws of the state in which the doctor is practicing. And again, no doctor or patient is legally required to utilize the rights granted to them by the Death with Dignity law. So measurement would be the same. Measurement of success would look exactly the same as it did in Oregon, which is basically just collecting demographic information on these people. If enacted, that's a win in and of itself.